Hey everybody, welcome back to Drug Talk. My name is Garrett Campbell. In today's video, we're going to be doing a more simplified version of a video that we covered in the past on Amlodipine. And we're starting right now. Just keep in mind that this channel is for information purposes only. So the first thing to discuss in this presentation is what Amlodipine is used for. So Amlodipine lowers high blood pressure and relieves chronic stable chest pain. We'll now discuss how to use Amlodipine. So first off, take your medicine as directed. Your dose may need to change several times to find what works best for you. Take this medication at the same time each day. And read and follow the patient instructions that come with the medication. Talk to your doctor or pharmacist if you have any questions. What happens if you miss a dose? So take a dose as soon as you remember, but if it is almost time for your next dose, skip the missed dose and take a regular dose. Do not take extra medicine to make up for a missed dose. Store this medication in a closed container at room temperature, away from heat, moisture, and direct light. Store the oral liquid in the refrigerator. We'll now discuss some warnings associated with Amlodipine. So tell your doctor if you are pregnant or breastfeeding, or if you have liver disease, or heart or blood vessel disease, including coronary artery disease. This medication can lower your blood pressure too much, especially when you first use it, or if you are dehydrated. So stand or sit up slowly if you feel lightheaded or dizzy. This medication may cause the following problems: so low blood pressure, worsening chest pain, or increased risk of heart attack. Your doctor will check progress and the effects of the medication at regular visits, so be sure to keep all your appointments. Do not stop using this medication without asking your doctor, even if you feel well. This medication will not cure your high blood pressure, but it will keep it in normal range. You may have to take blood pressure medication for the rest of your life in some situations. On this slide, we'll go over some side effects or adverse events. If you experience any of these, you just want to get in touch with a physician right away. So if you had an allergic reaction, which could present as itching or hives, swelling in your face or hands, swelling or tingling in your mouth or throat, chest tightness, or trouble breathing. If you had lightheadedness, dizziness, or fainting, new or worsening chest pain, swelling in your hands, ankles, or legs, as well as trouble breathing, nausea, or unusual sweating. Alright everybody, that's all we're going to talk about today with Amlodipine. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. For today, take care.